Let's talk about dentures. What are the different types of dentures? Why would somebody need dentures or want dentures? And what exactly do dentures entail? How many appointments? How do we make the dentures? How do you clean dentures? This video is going to be all about dentures, so stay tuned. So, as an example, of course, as we know, there are so many different types of dentures. Okay, so I have a little video here to show you guys. There we go. So, just to kind of show you how a denture kind of works. So, what it does is it's going to replace a missing tooth or teeth. This is called a partial denture here because it's partially covering the area. It's not covering the entire arch, it's just covering one tooth. I believe that was. In fact, let's watch the video again. So, yep, just the one tooth, but you can't just put a tooth in and, slap it on with some bubble gum or something, right? It has to be attached properly. And that's where these clasps come in. It needs to be fit and customized to your mouth. So that way, when you put the denture in, it's going to fit, it's going to be as comfortable as possible, and it's not a choking hazard where it's just going to fall out. So, this is a great example of a partial denture. Now, we also have something called an implant type of dentures. So let me kind of show you this. This is where now we can screw in dental implants and the full denture can go over top of the implant. So you might be wondering, why would you do this? Why would you put these implants in first? Why not just give somebody that full upper denture? Well, the implants is meant to help to retain the denture better, because what a lot of people don't know is that dentures, once you have them, the suction's not great. In the movies where some of those dentures can fall out when somebody's drinking or talking, that can actually happen if suction isn't maintained. If your denture is well made, of course, that's not a common occurrence. But if you were really concerned about that, because maybe you don't have enough bone support, especially the top teeth where your denture might be, either the top or bottom teeth, if there's not enough bone support, we're going to tell you we can make you a denture, but your bone is now so fragile because you've either waited too long or you're of a certain age where your denture could just kind of fall out. So, what's better is to get these implants placed first and notice how those implants help to retain the denture. So, the denture is actually kind of screwed in to these implant areas here, which is pretty neat, isn't it? So, this is another way to do things. But then we also have something. Let me just play this video for you guys. So, this is kind of showing it again, but notice how it's showing you on the bottom, but you can't see it, but there's likely implants underneath. But what I want to bring, okay, sorry, now it's actually showing you here. What I want to bring to your attention is, notice how real the teeth look though. When you have dentures, you don't want bright white teeth. You don't want teeth to even be perfectly straight. I mean, these teeth are perfectly straight, but we customize the dentures for you, for your teeth, for how your teeth are positioned, how your teeth are aligned so they look as good as possible. You can tell they're dentures because notice how the gum isn't quite aligning with the regular gum on the bottom here. But when you're talking, you don't see the very bottom or the very top here. So no one's going to know. It's just your teeth look better, they're healthier. And in this case, the bottom's retained by those implants that I mentioned before, where we had seen them in the top. So it's pretty neat the things that we can do, huh? And just another picture to really hit home these implant supported dentures. Now, I've been doing this now. I've been a dental professional for about 20 years, and I've seen a handful of times these implant supported dentures. They're not necessary, meaning they're not necessary in 100% of people who want dentures. We would only do these implant supported dentures if the patient really wanted dentures. That was the best choice for them, but there was simply not enough bone support to help those dentures stay in properly. So we would do these implant supported dentures. But most times we're going to give you either a partial denture or a full denture, and it's fine. You don't have to worry about the denture falling out.
So, as I mentioned before, there are different types of dentures, and I just kind of made a note here so I don't forget to mention anything to you. There's complete dentures, there's partial dentures, there's immediate dentures, there's overdentures, and these implant supported dentures. So, what would overdentures be? So, what they do is they basically fit over your remaining natural teeth or implants. So, I don't really have a video of that here. It was hard to find, but it's just a way where instead of having all of those clasps, there might be a clasp or 2, as I kinda mentioned up here, shown up here. There might be a clasp or 2, but it's mainly the acrylic, the gum-colored acrylic, like this part here, um, that will fit over top of your existing teeth. So it's there's still going to be a fake tooth on the denture to go where that, tooth is missing, but it's going to fit over top of what you have existing. These aren't very common because they can look kind of bulky. And then the implant supported dentures we talked about, but immediate dentures is when quite often, when we give you dentures, it's going to be several appointments because if we're taking out a tooth at that time, that area has to heal. We can't automatically take impressions to see what your mouth looks like now because it's going to be bleeding and things are going to be happening, right? We need to give you time to heal. So, quite often, when you're getting dentures made, it's not going to be made the same day. And also because we have to send your impressions to a lab for them to make it. Dentures aren't made in 5 minutes. They're made over several days, even several weeks, because they have to be perfect. At the lab, they go through your impressions. We take bite impressions. We take impressions of your top and bottom. Even if just one tooth is missing on the top, or on the bottom or wherever, we need to take those impressions of the top and bottom teeth because the lab needs to see how you bite, how your teeth fit together, how you bite together. So when the denture is made, it's customized to your mouth. So when you're wearing the denture, you're not biting off to one side or it looks funny or the teeth are too big or too small for your mouth. It has to be perfect. But immediate dentures mean it's all done that day. So there could even be a lab in the dental office, or the dental office has something with the lab next door or down the street where they can say, "Hey, I'm sending over my patient's impressions at 8 a.m. Can you have it done by 4 p.m.?" And they go, "Yes, we can. This is our only case today. This is what we're going to do." So it doesn't happen within a half an hour. You'll be hanging around all day. But what I've seen in dental offices quite often, there's a separate waiting room or a consult room where the patient has a TV. They can even take a nap, while they're waiting for their denture to be made. So that's what an immediate denture is. And then a partial denture, like I said, is something like this, where just one tooth is missing and there's a partial denture to go over that. Or a full denture, where again, these are implant supported dentures, but you get the idea. It's covering the entire arch, either the top or bottom or both. So, not just one tooth is missing, but all the teeth in that arch, either the top or bottom, are missing. Now, why would somebody need a denture, right? Like, why would somebody want this? Well, somebody would want a denture if a tooth is missing, or let's say somebody has a lot of cavities where the cavities are so big, we can't actually fix the tooth afterwards. We have to remove those teeth because things have gotten so bad. A denture, even just a partial denture, would be a great case for that. So the patient doesn't go without missing any teeth. But there's something that I'd like to bring to your attention, what a lot of people don't realize. Look at this nice man here. Okay. So he doesn't have any teeth, but notice how the shape of his face is kind of sunken in a little bit. Like you can tell he doesn't have missing teeth. He's a very happy, nice man. But he looks different than this nice lady here, where she has teeth. You can see her beautiful smile. She has dentures, but her teeth are customized to her, but they still look really, really good, right? Imagine this nice man here with teeth. Wouldn't he be happier? Wouldn't he look better? And having teeth or having, fake teeth on your denture actually helps to keep the shape of your face so it doesn't sink in, so it doesn't make you look older over time. Dentures actually help to keep you looking younger because your face shape is going to look so much better for it.
Now, what some people might be wondering is, well, who wouldn't we give dentures to? Well, the simple answer is if they couldn't handle all of those different appointments or if they couldn't handle impressions. If a patient was 89 years old and they're in a nursing home, but they're starting to lose more teeth, the number one thing we wouldn't say to them is, you need dentures. We're going to sign you up right away. We wouldn't do that because they can't handle a denture appointment, nor does it really matter if they have dentures. They're at the point now, they're in a nursing home or a long term residency where, yes, we're not saying we simply forget about them or we don't care how they look. Of course not. But putting them through all of those appointments doesn't really matter. Our goal for that is to keep them healthy, keep their teeth and their health well maintained, but we're not going to put them through denture appointments. And in nursing homes, dentures are often lost because they take them out, they put them on the floor, they don't know what they're doing, or another resident walks away with them because they have dementia and they don't know what they're doing either. And dentures are very expensive, if I haven't mentioned that yet. Could be anywhere from $2,000 to $10,000 or more. But of course, if you're 50 years old and you're a good candidate for dentures, it's an investment, but you're going to look and feel so much better with those dentures in. Now, so as an example, again, see the different changes in their face. She has dentures, she doesn't. Now, what I wanted to bring to your attention too, so I'm talking a lot about these implant based dentures just because it's a relatively new thing and people ask about them all the time. This is what an implant kind of looks like close up. We drill into the bone. There's a screw type thing to go in the bone, and then we put a crown over top to make it look like a tooth. See that? So that's an implant. But of course, let's say you just had one tooth missing, we tend to go towards this implant route first. We're not going to say to get a partial denture. We're going to say, how about you just get one implant? You don't have to worry about clasps or taking the denture in and out. The implant just stays there. You clean it like you would your normal teeth and mouth, and that's it. So that's kind of something to consider too. Implants are expensive as well, of course. But again, teeth are expensive. So take care of them now so you don't have to worry about them too much later on, right? So that's just an example of the implant there. And it looks normal. You can't tell that this person had an implant, right? It just looks like a normal tooth. Now, this is something that I wanted to show you too. For those implant supported dentures, this is another type. So, this is the patient's mouth, like their actual mouth. There's like, this isn't a denture. This is the person's mouth. But then you put the denture over top. But how did this thing go in? It was in using those implant screws into the bone, and then they're showing you the denture goes in over top. So this is again another way of an implant supported denture. I'm not trying to push implant supported dentures, by the way. It's just it's a relatively new thing. A lot of people ask about them, and these are some really good videos to show you what they look like. Look at these different types now. So this is a great example of a partial denture. These spaces here means those are the patient's teeth. So the clasps are going to go around the patient's teeth. These back teeth are clearly fake and they're onto the acrylic of the denture. This is a full lower denture. So the first one is a partial denture. The second one, actually, can I draw and show you guys? Maybe I can. Let's do black. So this first one is a partial denture. The second one is a full denture for the bottom. I can tell that it's for the bottom because the teeth are very small. This is a full denture on the top. So can everybody see that? This is a full denture on the top. And notice how there's more acrylic for the roof of the mouth. On the bottom, there's less acrylic because you need room for your tongue, right? So that's another way to tell top or bottom. Now, this is showing you a partial denture with the metal clasps, but also the framework in the middle. So, this is done because they're just trying to make it sturdier. The missing teeth are right here, but they couldn't just clasp over here. They kind of had to make it sturdier, but they couldn't clasp behind the denture because there's no tooth there because they're missing all of those teeth. But they weren't missing any teeth over here like this one. Because if you notice, there's two clasps here that help it retain better. But that's because they have two sets of missing teeth on either side. This person just has the one set of missing teeth. So, how are you going to retain that with only the one clasp? If you can try to picture that, it's going to be moving all the time. So, you have to put a clasp on the other side. But how is that going to attach? Well, that's where the metal framework comes in to help to attach to the roof of the mouth. I can tell that these are for the top teeth because the front teeth are bigger than these small bottom teeth. And you have all of this room here for the roof of the mouth. So, different types of dentures. Now, what I want to bring to your attention too is what people don't talk about are sore spots in dentures. I don't know if it's showing up well enough on the computer here, but this is a very red and inflamed roof of the mouth. So, all along here, that's quite red. If I was looking inside the mouth, that's the first thing that I would notice on somebody is, oh my goodness, that's really inflamed, but it's a little bit everywhere, not just a dot or a spot here and there. It's a little bit everywhere. That's telling us that denture isn't fitting properly. It's either time to get rid of that denture entirely if they don't want to wear dentures anymore, or we need to get that fixed. You cannot keep an old denture and keep putting it in the mouth because it's going to cause more sores, more inflammation, which is very painful. And it could even cause an infection if inflammation is left untreated. And unfortunately, in nursing homes, the people there don't tell you if their mouth hurts because they probably don't know, or they might say they're not feeling good or they're not hungry. But what they're really meaning is, I'm not hungry because when I eat, it hurts. But they might not think to say that, right? So it's very helpful to have a dental hygienist or a dentist come to see the residents of nursing homes often because these are the things we look for. Typically, in a nursing home, the PSW, the nurses, they have so many other things to do to attend to that patient. The mouth is often left just to deal with on its own. They might help to brush the teeth, but that's it. They don't actually look inside the mouth. So, this is very important, at least not usually. And you might not know this depending on who's watching the video, but this is the floor of the mouth. This is that tongue tie that's under the tongue, but this is very large. This is basically overgrown tissue from an ill-fitting denture on the bottom. That tissue has become inflamed, and it's causing more inflammation, and it's actually causing a mutation where more skin, more tissue is actually growing in that area. So, not good. This is why it's so important to look inside the mouth often. And last but not least here, how do you clean dentures? So always ask your dentist who had the denture made. Some dentures you're actually going to put in a cup of water overnight with a denture solution, and that will help to clean them. But depending on how they've been made and what material they had used, that might not be a good thing. That might actually cause the denture to swell up, and then it's not going to fit. So, in my experience, what you want to do is just simply clean it in the sink, not in a cup of water, none of that every single night, and then just leave it on the counter or somewhere safe overnight. You should never sleep with your dentures in. Your mouth needs to be able to breathe. This is so important. And truthfully, 80% of my patients do tell me, I sleep with my denture in because I don't want my spouse to see me without teeth, or I don't like how I look without teeth. So I just have them in 24/7. This is the way it is. But you're going to get sores. There's going to be inflammation. Please take the denture out at night. Or I tell people who are honest with me and who absolutely refuse and say they will not remove their denture at night. I tell them, when you're having a shower, when you're having a bath, take the denture out, allow your mouth to breathe and clean the denture. But ideally, it should be overnight for 8 hours to really allow your mouth to breathe, to allow your saliva to build back up. All of these things are very important. Now, I wanted to bring to your attention here, notice the sink. If you're cleaning your dentures in the sink, put a towel in the sink or fill it up with water first. Because if you drop this denture and it hits that sink or floor, it's going to break. Dentures are expensive. We can't just glue them together. We have to remake them. So put water in the sink. So if it falls, that water is helping to cushion it so it's not going to break, or a towel. So if it falls, it's going to fall on the towel, and towels are soft, so you don't have to worry. So, just a little side note for you. And dentures need to be cleaned every night, if not more. Sometimes toothpaste and a brush is actually too harsh for it. Some denture materials you don't want to use toothpaste because it's too harsh. Some say a mild soap and water, but in my opinion, I wouldn't want to use soap in my mouth. So I certainly wouldn't want that on my denture. So what I tell people is a mild toothpaste, even a little bit of baking soda with a lot of water, though, because you don't want too much baking soda. That's also too harsh. See, you just can't win, right? Too much or too little. But I tell people a mild toothpaste with a toothbrush is fine, but other dental professionals might not agree with me. If you notice your denture is getting scratched up or something, then of course the toothpaste isn't mild enough. But have I ever noticed that? No. But you do have to be careful because scratches on the denture can harbor bacteria, which isn't good either. You don't want the extra bacteria in the mouth. But dentures do need to be cleaned. And yes, I'm just kind of going over my notes here. Denture appointments, there's a lot involved. As I mentioned, there's impressions of the top and bottom teeth. They're probably going to take photos, bite registration. You're going to have to come back a couple times because what ends up happening is they have the dentures made. They're awesome, but then you put them in your mouth and something doesn't feel quite right. The bite often has to be adjusted. Sometimes the dentist can do it in the chair with like minor polishing, minor adjusting, but then other times they might have to remake a certain part of the denture to get it perfect because you want your denture to be perfect. And what I've noticed when I was a dental assistant many, many years ago, like 20 years ago when I first started, was we would have the denture come back, the patient would try it in, we would put another impression type of material in the denture, have them try the denture in that way, and then that's going to show us if there's any high spots, if it's not fitting properly, and then they would take the denture out, send it to the lab, and then that helps to show them even better, even more how they need to adjust the denture. So it can take 2, 3, 4, or more appointments, or if it's an immediate denture, it can be made that day, but I don't know too many offices doing that because you have to go back and forth to the lab. So let me know. I'm just checking again if there's any questions about any of this. I do hope that was very informative for you. Lots about dentures, the different types, what it's for, who it's not for. But dentures are still a thing. But I do find these days more and more people are keeping the teeth, which is what we want. So dentures are not as common. We might go for that dental implant to just replace one or more teeth instead of getting a full denture or partial denture. So things have definitely changed, which within the past 20 years, but dentures are still there and they're still being made. So please let me know if there's any other questions and comment below if you have any other questions, and I will read your comments as quickly as I can. And click a like to this video if you like the video, because that does help me and this channel. And I will see you guys next time. Thank you.